So, welcome back. This is the last chapter of the book. We're diving into chapter 15, the endocrine system. And this system acts as the body's long distance communication network, utilizing chemical messengers to maintain balance. Once again, by the end of the lecture, you should be able to recognize endocrine functions, master key structural word roots, and break down medical terms relating to endocrine pathology, diagnostics, and therapeutics. So, the endocrine system regulates key body processes, including growth, metabolism, and orchestrating responses by signaling other organs. So it's crucial to understand the structural difference between these two systems, exo meaning outside and crin meaning secrete. Exocrine glands use ducts to empty secretions onto a body's surface, like sweat or saliva. Endo meaning inside and crine meaning secrete. Endocrine glands are ductless and secrete chemical messengers directly into the bloodstream or lymphatic system. Here are just key combining forms. Adeno means gland. Adreno means adrenal glands. Adro means male or masculine. Um, Giganto means giant. Gonado is gonad. Insulino is insulin. Lodo is iodine. Okay, so mixo is mucus, pancreato is pancreas, reno is kidney, thyroid O or thyro is thyroid gland, toxico means poison. And these are some suffixes: gen, beginning or origin, physis is growth, tropic or tropin is stimulate, urea is urine or urination. So your adrenal or epinephrine is formed from the adrenal medulla and it drives the fight or flight response. Cortisone is a corticosteroid from the adrenal cortex and it reduces inflammation. Estrogen is the primary female sex hormone. Growth hormone is secreted by the anterior and it stimulates tissue repair and regeneration. Testosterone is the androgen driving male secondary sex characteristics, and thyroidoxine is secreted by the thyroid gland, functioning as our chief metabolic regulator. It's just a knowledge check. Time for a brain break. So let's go into the two conditions of that we associate with diabetes because they both share diabetes, but they're different. Diabetes insipidus, DI, is associated with the antidiuretic hormone ADH deficiency. So the insipidus means bland or tasteless, but this has to do with ADH. Diabetes mellitus, DM, is associated with insulin disruption. The mellitus means honeyed or sweet due to high glucose content. So these are some classic presentation symptoms that are associated with diabetes mellitus. Polyuria, poly meaning many, excessive plus urination. Polydipsia, which is excessive thirst triggered by fluid loss. Hyperglycemia, which is the blood condition. And glucosuria, which is sugar spilling over into the urine. Here's a knowledge check. So under thyroid disorders, we have hypothyroidism, Hypo, meaning under, deficient, and thyroid is condition. So this is when the metabolism slows down. Hyperthyroidism is excessive or over, and it means when the metabolism speeds up drastically. So the hyperpituitarism is treated with hormone replacement therapy. Um, the adenoidectomy is when a surgical excision or procedure of the glandular tumor, and this is typically from the pituitary. So anti-thyroid drugs are they chemically block the synthesis of thyroid hormones. A thyroidectomy is an excision of the thyroid gland. And you want to note that a total thyroidectomy is performed. The patient will structurally plunge into a state of hypothyroidism and require a lifelong synthetic hormone replacement. Insu- Insulin therapy is required for type 1 diabetes mellitus because the pancreas cannot produce insulin. Oral medications include metformin, which helps the body maximize its own insulin production and helps flush out glucose via urination. Here's a knowledge check. And we have our references. So we are all done. And this should help prepare you for the final.